Hi there, this is Teacher Mask. Welcome to our Physical Education 1 Movement Enhancement. This is our College Module Unit 2, Lesson 3. Are you ready? Don't forget to invite your friends to subscribe for more. Now take a look at this quick video class orientation. Now let's start with the body regions. The head and neck region. This is the head, houses the brain and major sense organs. It is also the framework of the face. The trunk or the torso is the central part of the body. The two sections are the thorax and abdomen. In the upper extremities, there are three regions: the arm, the forearm, and the hand. The lower part extremities are the thigh, leg, and foot. Here is the orientations and directions. The superior above or towards the head. The inferior below or towards the lower part of the body. The anterior towards the front of the body. Posterior towards the back of the body. Medial at or nearer to the center plane or in the inner side of the body. The lateral away from the center plane of the body. Proximal mirror to the center of the body. The distal farther than the center of the body. Now we have the range of motions. There are two types. The active range of motion are the limb is actively moved with muscle contraction. The passive range of motion, limb is passively moved and no muscle contraction. Now we have here the range of motions. There are two types. The active range of motion, whereas the limb is actively moved with muscle contraction. In the passive range of motion, we have the limb is passively moved but no muscle contraction. Now take a look at these body planes. A coronal or frontal plane divides the body into dorsal and ventral or back, front, or posterior and anterior portions. A transverse plane, also known as the axial plane or cross-section. This divides the body into cranial and caudal, head and tail portions. A sagittal plane divides the body into sinister and dexter, the left and right portions. Now, these are the three planes of motion. The transverse, that is a half of the vertical part. The frontal, that is the whole part of the front of your body. The sagittal is the whole one side part of the body. So take a look at this picture. This is a very good example of the parts of the body planes. A coronal or frontal plane, transverse plane, and the sagittal plane. So let's proceed to the physical wellness. Physical wellness is one of the important state of well-being and capability of each individual to design the optimum required personal fitness programs for improving and maintaining the level of health. Physical fitness is one of the examples of the wellness. If you are physically fit, you can do everything what you want. That is our topic in the components of physical fitness. Do you remember? So, if you are physically fit and you have your physical wellness, first you have your strength. And what is strength? The strength is the ability to sustain the application of force without yielding or breaking the ability of muscles to exert efforts against the resistance. So do you think you have strength? Of course, we have strength to maintain. We need to do the physical activities in order to develop our strength. Next is the flexibility. The flexibility determines how far you can bend, and it depends on how you can stretch your muscles without tearing them. Flexibility helps to prevent injuries by decreasing the tension of muscles. It also helps to reduce muscle soreness and enhance enhance certain types of athletic performance. The best way to improve your flexibility is by slow, deliberate stretching. Rapid stretching can be dangerous and ineffective. So we have 4 basic movements in flexibility. First, the flexion. The flexion is bending of the body segment. Second, the extension, straightening of the body segment. The abduction, moving a limb away from the body. The adduction, moving the limb towards the body. So we have the movements and we have the flexibility parts of the body. Now let's proceed to the types of stretching. First, the passive assisted stretching. Partner assisted the stretch. Second, the static stretching. This technique is widely used and effective techniques of stretching. This technique involves passively stretching a given antagonist muscle by placing it in a maximum position of stretch and holding it there for an extended time, at least 3 to 6 seconds. The last is the ballistic stretch. This involves an explosive bouncing rhythmic movement of a specific part of the body. So let's proceed to the movements. These basic movement skills are very important to an individual. If the students are properly learned with the basic skills, they are confident and competent enough to develop complex movement skills that will allow them enjoy any sports and physical activity without hesitation. They will surely move with ease and free from injuries. We have 2 practical principles. First, use all the joint that can be used. The forces from each joint must be combined to produce the maximum effect. Second, use every joint in order. This principle tells us when the joints should be used. Movement should begin with a big muscle group and move out through the progressively smaller muscles from a big to small. It is better to learn the 2 practical principles to organize your stretching. Thank you so much for watching. More uploads, please subscribe. You can share this video to your friends and classmates. Happy learning!